One. Hello, everyone. It's Mxiety. We are on tonight for another episode of Safe Point, a show where we talk about mental health related things to break the stigma. We do so by talking to other advocates, professionals in the field, people who understand psychology and really, have a good background in it. So that's where we are. That's where we are today. Safe Point. This is your Safe Point. Thank you so much for stopping by and being here, and and for just choosing to spend time learning with us today. Tonight we have on Dr. Fantasy Lozada, who is an assistant professor of developmental psychology at Virginia Commonwealth University, and she's director of the School Home and Internet Context of Emotional Development, which is really awesomely called SHIELD. I geeked out so hard. I was like, oh my, she works for SHIELD. She works for SHIELD. Are you kidding me? I geeked out so hard, especially because Marvel's now moved on to Sword, and so I was like, exactly. at least we have something SHIELD related. Anyway, so Dr. Lozada, if you'd like to tell us a little bit more about yourself.
Sure. So yes, I'm also excited that you geeked out about SHIELD Lab because before I became an assistant professor and I was applying for jobs and everything, I was trying to think of my research focuses on emotional health and development with a special emphasis on Black and Brown youth and families. And I'm also a really big comic book nerd and I love superheroes. And so I wanted a research lab that I could, that gives a nod to that. So that's a little bit of where SHIELD came from. And it's just spent some late nights trying to really figure out how to get that acronym together that would accurately describe what I do, and understanding this about emotional health and emotional development in schools and in homes, and also with experiences online. So the internet. And just played around with that a little bit so I could all in the service of being able to call my graduate students and students who work with me agents of SHIELD.
Oh my god.
So I
want to enroll at the school so that you don't understand. It's really cool.
When I recruit students, I wear my little SHIELD sweater vest. It's pretty corny, but
there's nothing corny. This is all serious. There's nothing corny about this. People in chat are saying Tahiti is a magical place. People in chat are saying they're nervous you might whisper Hail Hydra. So we're all with you. We're all in the same place. Would the vest be SHIELD armor?
Obviously.
So if you don't mind, so tell us a little bit more about yourself and your study and your background and how you came to study what you did and all that good stuff.
Sure. So when I was interested in pursuing some higher education, I was really interested in understanding a bit about families and very much a mental health sort of perspective and understanding about how families can help support mental health in youth sort of early on, and how that would translate to mental health later on. But when I really started to get into trying to understand what are some of the mechanisms or what are some of the factors that really promote good mental health, I really started to get into emotions and understanding that there's sort of power behind the things that we feel and how we feel them and how we make sense of those feelings and how it moves us through our lives. And so it just our everyday behaviors, but also in our mental health, how we take care of ourselves or how we don't take care of ourselves, because our emotions really sort of drive our behaviors in a lot of ways that we don't quite understand. And so my graduate work was focused on understanding how emotions are taught in the home between parents and children. And like I said, with an emphasis on ethnic racial minority families, because they are largely absent from the research body in general of what mental health is based off of what emotions are. And then when they are represented, it's very much from this deficit focus or perspective, and kind of that Black and brown folks are almost dysfunctional with regard to their emotions or robotic with regard to their emotions, and very little understanding of the context that really shape how Black and brown people come to understand and navigate and negotiate their emotions on a daily basis. So that's a little bit about how I got interested in it, was really kind of seeing that research and understanding that there was this gap and this need there to understand Black mental health, Black and brown mental health, but particularly from the standpoint of emotions.
Understood, understood. And that is huge. Do you find like as you're working like as a professor or when you're doing research, do you find like do people come to you specifically like black and brown students, do they come to you and say, I didn't realize that I had like this emotional baggage and trauma, or is it kind of and this might be an ignorant question from my perspective, like is it kind of like, no, I know I'm carrying all this. Thank you for helping me like understand it better.
Yeah, it's like a mix of both, right?
Okay.
Like groups of we're like not monoliths, the racial
Of
groups
course,
of
of
which we're
course.
like assigned
Right.
to. So uh it's definitely a mix of both, where it's like there are some students who are very cognizant and aware of like there's like a tax almost that they paid to like be successful in higher education spaces or in educational spaces, like pretty much to be able to navigate educational spaces in a way that you're successful, you're doing well academically, you've
Hmm.
got friends and all of
Hmm.
that, depending on the context. There's a certain way that you had to move through that space and
Hmm.
negotiate what it meant to be a black or a brown person and maybe a predominantly white school or even a predominantly black or brown school. But then as the higher you get into education, the more white those spaces become. And so there are experiences related to race, for instance, that students are very aware of, like that was a really difficult time for me, or that was a really like meaningful experience for me, and it made me feel all kinds of different emotions, and I maybe haven't unpacked all of that, but I know that that was impactful. And then of course there are other students who are like, maybe they take a class with me, or they hear about my research and they're like, you have just put a name to all the things that I experienced and never recognized I was experiencing before, or I never thought about it in that particular way, but I knew that I didn't necessarily feel good about it. So yeah, it's a range.
Yeah, yeah. What kind of and we're kind of talking about this, and so to kind of segue into the bigger, like what are the broader challenges that are unique to Black people in the United States that specifically contribute to poor emotional health?
Yeah. So, in this time period, I feel like people are becoming much more aware of, or hearing a lot more about, talking about racism and discrimination, and particularly structural racism and discrimination. Things about the types of neighborhoods and places where Black and Brown people have been able to, live, to find housing, and how close or not those places are to um, resources that would promote mental health, or resources that just promote general health, even that there not being a lot of access there, which is a really structural issue,
Right.
and even understanding whether or not I might need to go see someone for traumatic experiences that I have. There's also structural things that just related to the experiences that Black and Brown folks have had in healthcare spaces, whether that be
Hmm.
physical healthcare spaces or mental healthcare spaces. But there is a history there of how Black and Brown folks have been treated in those spaces, with or without their permission. Ways in which their bodies have been violated, their minds have been violated, and then after the fact is when people want to recognize, like, oh, maybe that was unethical, to not get your permission to perform particular procedures on your body, or maybe that I should have given you more information before you opted into this study that caused you some type of psychological pain or discomfort. And so there's a history there,
Yeah.
and so rightly so, there's a lot of mistrust
Yep.
that also contributes to whether or not Black and Brown folks will seek mental health professionals, and when they do, that they're looking for people who maybe look like them or come from
Hmm.
their backgrounds.
Hmm.
And also structural things around education and access make it so that there are less Black and Brown folks who may
Yep.
be trained as mental health professionals, to be able to provide those services. So there are, and those are just like three random things that I can bring
Right.
up, right? But there are a lot of entry points and access points if we're thinking about access to care for Black and Brown populations.
Yeah. Is so and do you find that generationally, I mean, within, from my experience, from where I'm standing, there is a generational difference of like people, yeah, millennials and forward are usually pretty like a lot closer to understanding and talking about mental health. Not all of us, obviously, but still. So, is there also like a generational gap there, or has the mental health system been so terrible and such a failure to Black and Brown people that, like, generationally, it doesn't even matter because it's just bad?
Oh, there's certainly a shift. There's certainly more talk about mental health. There's more talk about emotions in
Hmm.
Black and Brown communities and sort of the younger generations. And part of that, though, it's not happening necessarily in a traditional way. It's not necessarily happening like it's coming from mental health professionals. And now this generation is more open to hearing what mental health professionals have to say. It's a little bit more of like some grassroots type of movements that are more people recognizing like that as community members, we can support one another in ways that are sort of more authentic to our own cultural experiences, or that really like leverages the trust that we have in some of the people that we typically trust in our community. So if you think about Black churches and the church being a place where people might go and seek some counsel, or go and like really they trust on like the pastors and the deacons and the people who work in the church as people who can provide some advice, who can provide some support. And so that is sort of like a more informal space that, and honestly that's probably intergenerational, I would say, for Black communities in particular. But even seeing just more talk and more conversations that are
Hmm.
happening just on social media about, like, let's talk about mental health. Let's talk about self-care. Let's talk about ways that we take time to like really investigate, like, what are we feeling in our bodies and how is that related to the things that we're thinking and the types of things that we put into our minds. There's movements that are trying to bring mental health services into the community in unique ways, and leveraging spaces that are other safe spaces like salons and barbershops. So some really cool research by Dr. Afia Imbalashaka uh, with psychotherapy is what she calls it, and it's using hair as an
Oh,
entry point to mental health. And so thinking about, when you go get your hair done, that you're in this person's chair, like who's doing this, the doing your hair and giving you this service, and you're probably also talking. You're talking about life a little bit. You're
yep,
talking about, some of the experiences that you have, and you're mutually sharing. Well, think about if that person who is doing your hair actually has a little bit of training around thinking about mental health issues, or thinking about how to provide some emotional support. Like, how much more impactful is going to get your hair done or going to get a
right,
haircut?
right.
And it's a way that is really like relevant for the way that you live your life.
That's amazing. And is there still a, like, the older generation being like, "Hey, just suck it up. Like, why are you talking about emotions and stuff?" Or is it kind of now understood and like slowly becoming okay, I guess.
No, there's definitely
Yeah.
I
Yeah.
think still, sort of that gap or those barriers. And you will hear sort of younger African Americans, Latinx folks really kind of talk about this, and that like it's still a little taboo to really be kind of talking with your parents about, if you feel like you are needing some help or some support around mental health, if you're feeling like you really want to like explore, or talk more about like why this particular situation made you feel a particular way, there is a little bit of sort of a dismissal, or you all are thinking a little too much about your emotions, and
Sure,
it's
sure.
distracting to you. You need to like go ahead and move forward from this. Of course, that's like a broad, sweeping, general statement,
Yeah,
but there
yeah.
are a
No.
lot of barriers, just culturally, and to again just thinking back to like, is this like, is seeking mental health help, or like going to see a therapist, is that something that like we as Black people do? Is that something that we as Latinx people do? No, probably not, because we don't really have a lot of extra time and resources to be dedicating to our mental health in this particular type of way. That doesn't mean that previous generations completely like ignored their emotions, or they completely ignored their mental health. But did they go see a professional about it? Likely not. And so it is a little confusing to think that when your child is saying like, I think I need to go see someone, having some understanding of that, I guess I would say.
That's awesome. And when you do go see someone, you talked about the fact that there aren't, because there's so many issues with entry, there aren't as many BIPOC members that are psychologists and therapists and psychiatrists and all of that. So how does that kind of make things worse, I guess?
Yeah, there are a lot of different ways that could make things work. There are a lot of things that can happen. So, let's say that you're a person of color who you're dealing with a number of different issues, and some of them could be race related and some of them could not be, right? But you decide that you want to go see a therapist. You couldn't find one that maybe has a similar background to you, and,
Right.
and maybe you think that that's okay, but in the duration of therapy or in the duration of some of the conversations that you have, you may be experiencing microaggressions or these sort of small, subtle, they don't necessarily feel small, but they are kind of subtle, and sometimes they feel a little ambiguous with regard to comments about one's race or comments about one's background or comments about one's social identity in any particular type of way that are negative, and that are honestly just like an attack on your identity in this particular way. So those types of microaggressions can happen in the therapy room that really sort of break trust that a patient needs to really have with a therapist, and can cause more harm than good, or can cause more damage to a person who's already trying to seek some type of help.
That is something that I am most passionate about breaking through, because the number one thing that I have heard from people who just don't look like me is immediately when I say, "Hey, you should try therapy." So often I go, "Yeah, well, it's not going to be for me." And that was something that I confronted, I like seriously last year, where
Mm.
it kind of smacked me upside the head. And I really needed to start talking about therapy as not the like final uh, option for good mental health, because
Right.
it's just not accessible, and it's not accessible for everyone, and in the way that it is accessible is not acceptable for everyone. And
Exactly.
yeah, and that was something that like, yeah, that was just a big correction that I had to make. So anything anything that I can do to kind of to make sure that everyone feels comfortable when I talk about mental health. And if that includes not using therapy as like the end all be, because it honestly, it also isn't. It's not the end all be all for
Yeah.
anybody. But yeah, that was a big kind of smack on the head. That's just my tiny contribution. Um,
Yeah, I mean, I think that it's just important to recognize that the issue is complex. Like,
of
therapists
course,
can be all well-meaning, right? And they
of
can
course,
believe that they're trying to be culturally competent. But when we like, even we just like go all the way back to the research, like why I do the research that I do is because if there is no literature or there's no research that speaks to the emotion related or trauma related or race related experiences of Black and Brown folks for therapists to read about, then there, and it's all based on just like white people's experiences of
right.
emotion, then that's the only lens that they're going to have when approaching their patients or the people that they're trying to work with or support. And so there needs to be a lot more research done that represents the experiences of people of color, that therapists can have access to be able to grow their knowledge base. Like a really good example of this is thinking about some disparities that there are with regard to diagnoses for Black folks relative to white folks. And so um, Black Americans, particularly this is based off like U.S. data, that they're more likely to be diagnosed with a psychotic disorder than they are a mood-based disorder, and that is to say that someone who's Black and someone who's white could be experiencing and demonstrating the same type of symptoms, and the white person is going to be more likely to be diagnosed with a mood disorder. And the Black person is going to be more likely to be diagnosed with a psychotic disorder. And that has to do with stereotypes about Black people's behaviors and Black people's emotions and Black people as being aggressive. And as you can imagine, the treatments for those two sets of diagnoses are very different.
Right.
And so it's making it so that even when someone is getting access to care, they're not even getting the right care
Right.
because of biases, because of stereotypes.
Yeah, I recently had a girlfriend went to get diagnosed. Like she specifically went to a psychiatrist to get diagnosed to find because she was worried that her diagnosis had changed or that like just maybe she was misdiagnosed to begin with because she was originally treated by like all white doctors, and the microaggressions that came out of that like she had shared with me were like I like wanted to cry. Like if I was sitting in, and the fact that she had to sit in that seat and just kind of take it like from this doctor, the things that he said things like so she had been to jail, so he's like, oh, you don't like you look like somebody who'd go to jail, or you don't talk like somebody, something to that extent.
Right.
And like those are all things that I don't think you should say to anybody, period. But also, like, you have to have some kind of self-awareness to know that what you're saying is not okay
Right.
and is hurtful and is like it's targeted. You're saying something that you wouldn't say to somebody else, and that already means that you're saying the wrong thing.
Right.
But like that's terrible. And that was her and she was like, you know what? It wasn't even that bad because my normal therapist is fine. I just wanted to get a diagnosis, so I had to go. I'm like, that's awful. So your options are great therapist, who's black and gets me, or I can go to some racist jerk who's going to possibly misdiagnose me. I can't even trust his diagnosis now, but like it's cool because I don't have to see him every day. I was like, those should
Right.
not be anybody's options. Just to talk about the difference in experience, I have went to doctors that have said unacceptable things, that have like maybe like had unwarranted sexual behaviors towards me, like stuff like that. But I have never once been made to feel like what I am saying is wrong because of what I look like, or what I'm saying can't be right, or like I can't be saying the truth because of what I look like. That has never happened to me. Like that's awful. And yeah, it gets me riled up. Sorry.
Yeah, I mean, and the extent to what somebody believes what you're saying, being based off of what you look like, the color of your skin. It's parallel to the things that happen to Black people, and particularly Black women in medical spaces, where
Yes.
it's about like they don't believe whether or not they're in pain. There are literally, people, medical doctors who are still being trained to believe that Black people have a higher pain tolerance than white people, or that their skin is thicker than white people, like physically. I'm like not saying that metaphorically. Like there are people that these are still like myths about Black people, about like a superhumanness of Black people that are still propagated like in the medical field broadly, and as you can imagine, probably in the mental health field as well. Just thinking about sort of the strength of Black women, and that
Sure.
they can't possibly be experiencing the type of the same type of mental trauma or anguish as someone else, as perhaps a white woman, because they don't feel emotion in the same way that white people
Oh,
do. They don't experience it the same way that
oh
white
my
people do.
God.
So
I'm
yeah.
I'm so grateful that you're talking about this because it's just not talked about enough. And when it is talked about, I have found that people have dismissed it, and I keep like I hope that people are. I want people to listen, because just because you have had a good experience with a therapist doesn't mean that everybody else has. And I want to make that so abundantly clear that we are not because I feel like people will often be like, it's the 21st century. Like, we've got it. We're not, eugenics aren't a thing anymore. And I'm like, eugenics were the last of the last of the tip of the iceberg of stuff that is still going on that people just, again, just don't talk about because it doesn't affect them. Because when they go to the doctor, they're heard and they don't have to think twice about whether their diagnosis was correct. And I'm not saying, and before anybody like comes at me, I'm not saying these are big blanket statements. Yes, white people can be misdiagnosed.
Absolutely.
I'm not
Absolutely.
pretending that like all white doctors are racist either. Like I'm not saying any of those things. These are big blanket statements. I'm talking about the fact of the matter is it shouldn't be happening at all. Like there should not be these situations. And so whether it's one doctor, two doctors, or 100,000 doctors, which is more likely the case, doing this, it shouldn't be happening. And so if we can have conversations about this, if we can raise awareness around this and give people the tools, like even if one non-white person walks away from this and goes, maybe I need to think about my diagnosis because I didn't necessarily, maybe that didn't sit well with me, but I didn't feel empowered enough to question it. That would be like, that's what I want.
Absolutely. And well said, because, also like what I want people to always understand is like, especially like when I'm talking about research, like research is taking a whole bunch of data points. So it's not just taking like my personal experience
Right.
or that person over there's personal experience.
Right.
It's taking a whole bunch of people's personal experiences and telling you on average, this is what the trend is. On average, this is what the pattern of behavior is. So when I'm talking about misdiagnoses, it's not that this one or two people
Right.
here or there had been misdiagnosed. It's
Right.
on average, if you look at the diagnoses over literally thousands of cases,
Right.
on average, this is what you might see. So I think that's a really important point to make, that, it sounds like we're making broad statements. Everyone can always find an exception.
Yes,
but
that's the other thing.
it's this is when we're talking about based in research, we're talking about, multiple, many cases, many
Right.
data points.
Right. No, that's thank you for that. That because I just don't need the whatabouts. If you I don't think I love my community. I don't think anybody here has said a what about. But if you're sitting and lurking and you're thinking about a what about, don't do it, because you will hear from me. Okay, so let's talk about this, because we briefly touched upon this, and I'm sorry if this will be redundant for people, but I want to make sure that this is also there for people who are watching this later. What are microaggressions, and how and why do they affect people's mental health?
Yes. So how I was mentioning them before is, if you think about, people tend to be like, oh, well, racial discrimination is like when this like really like somebody gets called the N-word,
Sure.
or somebody gets called a racial slur. It's something that's very like blatant, and you would be like, oh, people wouldn't dare. But hopefully you don't actually think that, because people still do and often do dare to use racial slurs toward people, right? But that is kind of something that's a really blatant experience that you can really point to well and say that is a not okay racial discrimination experience. But microaggressions, on the other hand, are these things that they seem subtle. I mentioned them before. They seem subtle, and they also seem in some ways ambiguous, because they're kind of small. It might be in the ways that people respond to you. It might be in the ways that, I always think of a good example of this, which is a common one that people hear, is like a woman clutching her purse when a Black man walks by her. So she didn't say anything to him, and she didn't call him a slur, and she didn't like hatefully look at him, but she reacted in a way that he was dangerous based off of no information.
Right.
And as a Black person or a Black man who might, experience that, he then spends his like cognitive time like thinking about, like, why did this person do this? I was just walking, like I'm walking my dog, or I'm just like going to the store, and I didn't approach this person in any type of way. Like, what does that mean, and why did that happen, and all of this. And so the reason why these kind of subtle and almost ambiguous situations are sort of dangerous as microaggressions is because of the thing that I just said. You spend a lot of your cognitive time, energy, and effort trying to understand the experience. And is that about you? Like, do I internalize that? Is it because I look dangerous, or is it because I'm Black, or a person of color? So there's this additional processing that you have to do about microaggression type of experiences. And when you experience microaggressions over time, you're kind of, either you're internalizing that a lot about you, like there's something negative about me that makes people react to me in a particular type of way and treat me a particular type of way, as you can imagine is not good for your self-esteem, the ways that you view yourself. Or you then might have to think about it. It's like, well, maybe it's not about me. Maybe it's about something else, or,
Right.
it's about me, but it's not literally like I can't control that I'm Black.
Right.
It's about this other person. And that is sort of a healthier way that somebody can potentially deal with it. But it doesn't necessarily, even though that's a healthier way that you can think about it, it doesn't, it still doesn't necessarily take away the sting of those experiences. So they're just kind of like the death of a thousand cuts. If you think about that, it's like these kind of very small experiences that take a ding at you constantly and every day. And if you're experiencing that at work, and you're experiencing that at school, and you're experiencing that in your community, it's sort of like a buildup of stress that takes a toll on your mental and your physical health.
Yeah. What is so I mistyped this question, and I feel so bad because you responded to it, but so I asked you about what is general trauma,
Oh.
but I meant to ask what is generational trauma.
Oh.
And I didn't realize it until I was re-going through all the questions today, and I was like, why? Anyway, so if you could, we also, you briefly touched upon generational trauma and how that is, affecting people. So if you could kind of explain that a little bit, that'd be great.
Sure. Like thinking about generational trauma, or the way that I often think about it and conceptualize it in my research, has to do with the experiences, especially of racism, that you're exposed to, that maybe not necessarily you directly experienced yourself, but it's sort of like you're a part of a legacy that experienced this particular type of trauma. This racialized trauma that I'm talking about, for instance, could be slavery, for African Americans. And so it is the trauma that sort of generationally, people who looked like you and the people who begot you, experienced really traumatic treatment that, research really indicates that has gotten under the skin in some way. So people who survive these experiences, they passed on sort of their genetics, that is manifested in both behaviors and mostly, what am I trying to say, like mostly manifested in behaviors and physical characteristics, that gets passed on from generation to generation, that was for survival, for the experience of traumatic experiences. But as it gets passed to the next generation and next generation, you're not only passing on genetics, but also the actual shared history of what that trauma was. And with slavery being, let's say, one of those key generational trauma experiences, it wasn't just that slavery happened, but it's all the aftermath that happens from slavery as well. So the continued, oppression and the continued terrorization of Black Americans. We go all the way to Jim Crow segregation and that type of experience, the fight for civil rights and that experience. These are all interlinking, generational experiences that, yes, get under the skin, but are also sort of passed down in the knowledge of like who you are and who your people have been in a space and a place, like in the United States. So the trauma that you're experiencing, is being passed down from family members, from their experiences, from them telling you about those experiences, but also the literal ways in which they had to deal with them that was physically manifested in themselves. I don't know if I explained that in the best type of way. So we can
I don't
continue to
know.
talk about that.
I mean, if anybody has, so we do have an open, question portion that's coming up. So if anybody wants anything elaborated upon, please do ask, and we'll see what we can do. But I mean, makes sense to me, for whatever that's worth. So what can we do? You specifically mentioned kind of, in generational trauma and in trauma in general, a lot of it starts with children, right? It's so like if you have a working parent who's overwhelmed, and they're not home a lot, then that's affecting the child, and the child is growing up then not being aware that they were traumatized in some way in their childhood, and it's et cetera, et cetera. So what can we do for Black and Brown and POC children, to to like mitigate that? Like, what can we introduce earlier on to help?
Well, one thing that, Black and Brown families have been doing themselves for a very long time to mitigate that, to mitigate thinking about that generational trauma, are having actual conversations about race, and ethnicity and discrimination, in the home, that happened very early on. So some of you may have heard people refer to it as the talk, and it's not like the talk about the birds and the bees, but it's like the talk about, literally about discrimination, literally about the ways that you have to move in this world as a Black or a Brown person to be able to be safe, and to be able to come home at night, and to be able to, kind of like have uh, some mental support for yourself when you like move through this world of like, how do I deal with these discrimination experiences? And so I think it's like Procter and Gamble, they had done these, they had did a really well done commercial about the talk, that really depicts this really well. And you see literally a mom like combing her daughter's hair, and when her daughter tells her about how someone told her that she was pretty for a Black girl, like that was not a compliment. and like, what did that person really mean by that? And don't let anyone ever tell you that, because that type of thing is not true. Or you see like a mom talking with her daughter in the car about, if you get pulled over, this is how you need to act, and this is what you need to do. And the daughter's kind of trying to like brush it off, but she's like, I'm going to be okay, right? And that pause there is still like pregnant, because it's like, is she gonna be okay? Sorry, I get emotional when I talk about this.
I'm getting emotional,
So...
and I thought I was like being a wuss. I was like, this isn't about you. Don't you dare cry. But I'm getting really emotional because, no, I mean, like, as a woman, I've had conversations about my safety,
right?
But they're not the same as
right.
as somebody having to have conversations about their safety because of their skin color. Like, those two completely freaking different things, and that
right.
like that grabs at my heart to have to talk to, like, my heart is pounding so hard to have to talk to your child and be like, I can't guarantee your safety as a parent. How I can't, like, if that doesn't grab at you and explain to you all of, like, highlight, not explain, highlight the discrepancies between our experiences of white and non-white people, I don't know what will. Like, that was a big slap upside the head for me. So I hope people listening to this maybe have a similar reaction.
Yeah, it's the reason I bring it up is really to say, like, parents have been trying to do this they've been trying to find ways that they can like kind of give their child some protection as they move through this world. And some of that is some explicit conversations about the things that could happen to you as a person of color in this world. And also some of those messages are about having pride in who you are, having pride in who you come from, having pride in the fact that you are a part of a legacy that overcame these experiences. You are a part of a legacy of people who have found a way to make it work. And although we don't want it to continue to be that way, we don't want it to be like you found a way to survive, you should still feel proud in that type of thing. And research really suggests that when Black and brown children get both of those messages of like a real reality check of like, this is what the world is like, but also these are the ways that you should feel proud about being who you are, that's really protective when kids experience discrimination. It lessens the effect that you might see on things like depressive symptoms or anxiety symptoms, or even things like, externalizing or internalizing like some type of aggression. So that's one thing. Like, families are doing that, and supporting programs or supporting organizations that help families to have those difficult conversations. Because I also want to say, like, just because you're Black or brown, it doesn't mean that you're really good at talking about these things. Sure. We're not. I'm not always good about talking about these things, and I study them. So parents, as you can imagine, may want to be having these conversations with their kids, but may not feel wholly competent in doing that. And I have a really amazing colleague, Dr. Rihanna Anderson, who does research. She has a program called Embrace. And this program is like a therapeutic program that largely for Black families, and teaching them, how do you have these conversations with your children, and how do you like talk through these difficult discussions about race in a way that like really honors the emotions that it brings up, the unresolved feelings that parents may have about their own race-related experiences when they're talking to their kids about race-related experiences. And so that I love that program, because that is a way of like helping parents to just continue to have this conversation, even though it's something they've naturally been doing. There are also programs that are trying to help schools and teachers to provide more culturally affirming, but also real sort of critical conscious building experiences for Black and brown youth in schools. Schools are a really probably one of the institutions that like of course touches the most children, but is able to provide like the most in terms of benefit for mental health services. Mm-hmm. Like, if we can continue to get more emotional support, socio-emotional support staff, mm-hmm. mental health trained staff in schools, that is going to be a game changer if we could push for more of that. For kids just broadly, but for mm-hmm. Black and brown youth in particular, some culturally competent care in schools, teachers who know a bit more about how can I connect with my Black and brown students, even if I'm not from that background, and ways that like affirm who they are and make them feel like they're supported and make them feel like emotionally we have this connection. That can also be something that is protective for youth's mental health it also, as you can imagine, reduces the extent to which Black and Brown youth may experience things like microaggressions in the classroom and in
Right.
schools,
Right.
when people have more of that cultural competence. So if teachers have it, if administrators have it, but also we have some trained folks in the school that can do that as well.
Thank you. Thank you so much for elaborating and sharing on that. I have one question left on my queue, and then there's some amazing questions in the queue from the audience, and I'm really really honored for those. So
Cool.
thank you so much. But so the last question: what barriers can we remove to make mental health more accessible to everyone? Like, what are some do this? Not maybe do this tomorrow, but like start doing this.
Right. I mean, well, I started off at some point talking about some of the structural barriers, and
Right.
particularly structural barriers around, educational attainment, and also like higher educational attainment and access, for people more broadly. Like education is not as accessible as it needs to be, and we're all talking about things like the debt that people go into to be able to achieve higher education, but that is also particularly stacked against Black and Brown folks, so that they are not able to sort of get the certificates and the trainings and the higher education that they need to become mental health care professionals. So the extent to which we can continue to like fight for, push for, advocate for better educational access broadly is important, and particularly in thinking about opening education up, all the way sort of to elementary schools, low resource schools, trying to figure out how can we get resources to for education more broadly can help to even the playing field for racial disparities that we see in education. But the biggest thing that I think about, like, what can we do? Like, structural change is slow,
Yes.
but we should still push for it.
Of course.
But of course,
Because then it's not happening at all if we don't push.
It's not happening at all.
Right.
We need to push for structural change. But some of those things that I was describing to you before about making community spaces that are familiar to, that are trusted to for Black and Brown communities, those spaces accessible mental health spaces, that I think is something we can move the needle on a little more quickly. So as I mentioned before, psychotherapy is this movement that is literally training people who are barbers and hair stylists and other people who are interested in moving into that work to have some mental health training, to be able to provide some services to people who are their clients, right? There's also a movement to provide more of that type of training to clergy members or people who are in the church. Again, like I said, the church is another place like that. So getting creative and thinking about what kind of community spaces do people trust and that people go to, that where they feel affirmed and they feel celebrated, and then getting that training for people who are in those spaces, I think is one of the probably easiest ways to break down some barriers for mental health in a way that is not going to just like open up Black and Brown people to having to go to white therapists and white spaces that are not trained and equipped to really provide them the help that they need. And again, we're not saying that all of these spaces are overwhelmingly negative or bad, that there's still some good in being able to like receive services from these spaces, but it's just not wholly accessible, and it's just not wholly affirming, and we want to minimize the damage that people are experiencing when they try to go seek mental health services.
Yeah. Mental health first aid, fam, can't recommend it enough, seriously. And they've been doing also a lot in talking about various cultural differences, which I'm very proud of, because when I took the course originally, that was not in there. Like nothing specific was in there. But thank you. Oh my gosh, thank you so much. All right, now we go into our questions. So I am going to close the queue because we already have quite a few questions, and I want to be conscious of Dr. Lozada's time, of course. Okay. Impartial Peer asks, how do you handle hidden racial phrases such as, "Oh, you speak well, I'm impressed. Context is missing, but I don't know how to convey it"?
Yes. So going back to some of those microaggressions again, those are definitely some really good ones. It's like, "Oh, you're so articulate. Oh, you speak really well." Or, what you said earlier, Marie, about like, oh, you don't look like a person who has had whatever XYZ type of
Right.
experience. I don't really know what you necessarily mean by like, how do you handle them? Like, how do I personally handle them, or how should people handle them
Yeah, I'm
specifically?
not sure either.
But regardless, being able to recognize what it is, I think is really helpful for people. So it's kind of like what we talk about with emotions. Like if you're able to like sort of name and recognize what emotion you are feeling, that is really powerful, because then it can give you a handle on like, okay, well, okay, this is what I'm feeling, like what made me feel this way, and then sort of what can I do about it to make myself feel better. But so it's kind of like the naming of things is like a first step of that. So similarly with something like microaggressions, like the naming of what that experience is important. Like, okay, I had this experience and I think they were kind of trying to say something that like was reflective about my race or about my gender or about whatever it is. And then being able to identify yourself, like, how did that make me feel? It's important that you're acknowledging about how that made you feel, because it's important information for you. It bothered you in some particular type of way. And then you can kind of figure out like the what's next for that. What do I need to do to resolve how this thing made me feel? Maybe I need to confront the person, or maybe I don't, because I really don't. It's like, I don't have the time today, or I don't feel like it today, I don't have the energy today. And that's okay too, if that's what you decide to do, 100%. But you can at least say like, this thing made me feel this way. I have made the choice that I'm not going to deal with it. Maybe I'm just going to let it slide. But then you can kind of let it go. You need to, but the thing with the microaggressions, because they're subtle, or because they are a little ambiguous, you do have to do a little unpacking of them. Again, I said this is a cognitive cost. So, maybe it's not always the most practical thing to do in the moment, but it is something that you can practice doing, to sort of deal with it and to try to lessen the negative effects it may have on you.
I would argue that you're probably cognitively, having to somehow deal with it anyway. You might as well figure out the healthiest way that you're going to have have thoughts about this productively, right?
Yes. And also just talk to somebody about it. Sometimes that's the other thing. Sometimes you just like, you want to, like, I do this all the time with a friend. I'm like, oh my gosh, this person said this. Isn't that ridiculous? Or you let your friend kind of like, laugh with you about it, talk with you about it. Like you kind of say like, what you should have said, girl, was this. And you're like, yeah,
next time I'll tell
them. Right. And then you can kind of, there's some humor that you can add to that. Right. Or there's actually just some camaraderie. There's some real comfort in being able to share that with someone. So definitely kind of unpack it for yourself, but also share that with someone else that you feel, you can trust to unpack with as well.
Cartless Bruja asks a question that, and please it's not insensitive or anything, but I don't know the answer to this. So let me know if you also don't. We can just, Cartless. So the question is, have you worked or studied anti-violence programs like Ceasefire in Oakland/Boston?
Oh, well, no, I have not at all done any of that work in studying anti-violence programs. And I guess I would say also, as a caveat, there are lots of different ways that people sort of approach their research with regard to Black and Brown communities. And I make a really intentional choice to engage in research that is not in the, unfortunately, stereotypical types of topics with regard to Black and Brown communities. Some of those stereotypical topics, as you can imagine, would be things like violence and aggression,
drug use or something.
Drug use, exactly.
Yeah.
And so these are often topics that I intentionally don't study. People study those things. They do really amazing work with those things. It's valuable to study those things. I just make this choice to study something else that is very understudied with regard to Black and Brown populations. So I'm sorry that I can't speak to that at all.
Thank you. I Hate You and Dinosaur asks, do you think that recognizing Black mental health as a public health concern the same way that we recognize racism as a pandemic would be helpful? Hopefully that makes sense.
I do. And those things are sort of hand in hand, like the racism, structural racism, interpersonal experiences of racism, cultural racism, all of these things contribute to the disparities that we see with regard to Black mental health, whether that is in us seeing lower rates of some diagnoses that might not necessarily make all that much sense. Like I said before about like mood disorders, sometimes people will be like, oh, well, Black people aren't depressed a lot. Well, is that really true?
Right.
Or or do we have an issue with misdiagnoses there? And so being able to recognize the connection that racism has to Black mental health and recognizing that as a public health issue would absolutely be, I think, essential to trying to move the needle on policies that might need to be changed, and structures that might need to be put in place to be able to make healthcare more accessible for Black and brown folks.
Thank you. Thank you so much. Sir Pantero asks, do you think that explicit discussions about generational trauma should be included in history classes, such as around when we discuss slavery, Jim Crow, and the Holocaust, to help people grasp the concept?
100% yes. Thanks for that question. We just have to talk about it, and it's going to make people feel uncomfortable. Everybody's going to feel uncomfortable about it, but explicit talking about it with regard to like in history, and with regard to our social studies curriculum, in ways that allow for people to sort of to get the facts for sure, but also allow people to talk through the emotions that it brings up, is important. Because again, sometimes our barrier to understanding or our barrier to want to listen to facts like that has to do with the emotions that are being brought up for us when we hear those things.
Mm-hmm.
It makes you feel uncomfortable because maybe that wasn't what you were taught. Maybe, somebody that you loved and cared about, your family member, told you something else. Mm-hmm. And so then you think to yourself, like, well, why did they not know that? Or why did they tell me that? So that brings something up for you. Or, you feel ashamed because maybe you feel like your family in some way was like you're connected to that. And how do I deal with that shame? So the emotions that happen in these conversations, even if it's something like history class, when they're not recognized, they just pose a barrier to people, hearing it, but then like kind of taking that with them, being able to accept it and understand it. And I think that is a thing that we experience a lot, like when we're seeing people on social media, like being confronted with facts, but like there's still a lot of denial, like, well, that's not true because X, Y, and Z, or they're more likely to believe in the misinformation because maybe the misinformation honestly just makes them feel better.
Yeah, we don't, Bliffle made a really good point. If you're learning history and you're happy with what you're learning, you're not learning the truth. Yeah.
Oh, absolutely.
I really like that.
Absolutely.
Yeah. Yeah. If you think everything was hunky-dory, you're reading the wrong thing.
It's the wrong thing. And it just doesn't even reflect human nature. And that's what I think is astonishing sometimes when people are like, well, no, it was all like, it was good. And, the Black people were okay with being slaves. Like, does that even really make sense to you?
Right.
Logically, like would you feel good about somebody making you a slave? Would you feel good about that?
Right. I feel like people who say that haven't like taken a second and like cracked open a Frederick Douglass book or something, like it's not that hard to take a second and give a little bit. I'm not saying I have a ton of experience and I have read Frederick Douglass, and that was not that hard. And being able to read that, I don't think there was even half of a point where I was reading that and I was like, wow, this sure seems like a great time for everybody. Like, what? I also worked at Pearson at the time. I'm sure you remember the controversy of they were deleting instances of slavery from the Texas book. And so people said it was countrywide. The reason they say that is because Texas has one of the Texas obviously is the biggest purchaser of textbooks. So if Texas changes something, that makes a reprint for the general book have to change because that's just cost effective. Right. So, but yeah, I remember sitting there and they're like, you have to put Post-its on every mention where there's slavery. And I was like, I like, what do you do? What do you do? I wasn't in charge of rewriting and I was an intern, but like, what do? You go, no, I'm not going to put Post-its on here. Like,
wow.
Cause it's, yeah. But I still tell that story. I'm like, yeah, I was complicit because, but like,
well, that's what I was like. What did you? I'm thinking to myself, like, in the moment, were you like, what are they doing with this?
No, I definitely was. I specifically because I had heard about it in the news because they started talking about the fact that they were going to edit books, and then at the time I was like, oh, like I was a doofus and did not put two and two together for a second, definitely until it was like second day, and I came back and I was like, but why these specific paragraphs? Because then we were going through first, oh my God, I swear I'm a researcher. First sources, what am I, the word?
Primary sources?
Primaries, oh my God, yeah. Oh my God, I'm so embarrassed. Yeah, so then they would pull up other primary sources so that we could replace that information. And so it's replaced with other truths, but it's
Well,
removing things that need to be said as well. So yeah, so I remember I was talking to the person who was like in charge of the internship, and they were very much like, yeah, well, we're not, and she was Jewish, and she's like, yeah, no, I'm not happy to be doing this either, but it's for Texas. And the biggest argument that she had said that she was making was trying to keep it to Texas specific so that they could have their, take it. You want
wow,
it this way,
yeah,
okay, but not
wow,
everybody else has to consume
yeah.
this. So I don't know how that ended up because those were high school textbooks and I was in college, but I remember like nobody agreed that it was the right thing to do, but everybody did a piece of it.
Right. I mean, and that's the thing. The thing that we want people to understand when we're talking about, like, we want people to understand about systemic racism.
Mhm.
We want, this is a very systemic thing that happened there,
Yeah.
right? That's literally,
Yeah.
literally we go to school to be taught and indoctrinated and socialized
Yep.
in the history of this country and in the ways that, like, the ways of being an American. That's literally what our school system is for. People may not agree that that's what it's for, but that's what's happening. And so that's a systemic thing that happened. And if you don't recognize that the kind of, it's a systemic thing, it has repercussions in this very large way, people won't speak up about it. And it's hard to be the only person to speak up about it. It would be hard to be an intern in a large textbook publishing company saying, like, this is wrong and I'm not going to do it, because you could say that and you're going to be fired. And
Or they'll just be like, okay, well, don't do any, like, whatever, you're the intern.
or just don't do it.
Yeah.
Or yeah, you're
Yeah.
the intern or what have
Yeah.
you. So it's the higher up and the higher up and the higher up. It's sort of the collection of people that need to speak out to that. But and part of that is having people at the table who represent different perspectives, different life experiences. You can't have all white people at the table
They
making
were.
decisions about. Of course they were.
Yeah.
It's
No,
fair
they all
said,
were.
like,
The only
of
the
course they
only
were.
the only mention, we were working on an app as well. And the app, I remember, had a lot of conversations about like our mistreatment of Native Americans and stuff, but it was a different grade in history. So
Hmm.
I'm hoping that had something to do with it. But I remember the app was like very, very like there was, I don't know, maybe if I look back at it, it would be bad. But I remember there were no red flags about the app because I remember I had to fact check it and I was like, this is all checking out. But the textbook thing was like a giant red. Like I still walk around thinking about that. That's the kind of stuff that I'm like brushing my teeth and I'm like, I did that. I fucking did that.
And it's why it's important for
Yeah.
like teachers, also like teachers themselves, as you're like going through curriculum and all of that, for you to do your due diligence and to present other sides of the story, other perspectives of the story, because the mainstream story, what you're going to get is going to be the overwhelmingly white version of the story, or the conqueror version of the story, or the colonial version of the story of like the people who won, from the perspective of the people who quote unquote won.
Mhm.
But if you go and you get the perspectives of those who were marginalized at the time, you add Frederick Douglass to this discussion, right? You read some of the things from like slave narratives or what have you. You're presenting a more well-rounded picture of what happened, in a way that then you're kind of building students' critical thinking skills as well. And in terms of like, there's not only one side to a story. There's not
Right.
only one
Right.
way to think about this. That when we're doing that, we're kind of just telling students to like blindly, or children to blindly accept facts. But there's lots of different facts that like sort of make up this whole puzzle. And I mean, sometimes they're not even all just facts from this one perspective. Like what I'm trying to say here is like the whole perspective is really the fact. It's not just this one perspective from the people who control the knowledge or control the narrative.
Yeah. Well, and you would hope that like that kid and that's not going to happen because parents are busy and everything, but you'd hope that that kid comes home and then has a different conversation with their parents, so they're like, "No, well, you actually should also learn this thing." That's what you would hope, but that's, you know, maybe
Right.
they didn't learn it, so how are they going to talk about it, et cetera, et cetera. Yeah. It's the facts with the context. Exactly, Frankie. Nanosphere asks, how would you try to reach people who have been so harmed by structural and institutional sources as people of color, as women, as queer people?
Mm. How do I try to reach them? I'm
Yeah,
sorry.
how would you try to reach people? Uh yeah, how would you try to reach people who have been harmed? So like what can we do, I guess, to raise awareness that like, hey, things aren't right. Like what's happening to you isn't right, isn't fair, isn't how it's supposed to
Mm,
be.
mm.
That's how I'm interpreting it.
Right.
Nanosphere, let me know if there's a different way to perceive it, and any clarification is awesome.
Again, I'm really seeing a lot of sort of movements from within those communities to that are speaking out again, or speaking out against sort of these systems of inequality, particularly around mental health, particularly around traumatic experiences. Like the conversation is certainly happening more, and it's happening in a lot of different places that I think are therapeutic for people of color, for trans people, for people who are sort of marginalized in this way. So when I'm thinking about like how are people being reached, I'm thinking again about like who's really doing this work. Well, this work, and it's people who are in the community, people who are already providing services or trying to provide services that may not be mental health services, but they are sort of the support in the community for whether that be people of color, for that be for trans or queer people. I think that there are people that people are beginning to feel empowered to empower their own people. I certainly see that a lot. And also, as that is happening, trying to sort of do a little bit of education to sort of other people to kind of like, oh, well, fix the systems. Like, if we've got our own people, or if we're kind of supporting our own people, we need you to fix the system, or we need you to be, let there be seats at the table for us to tell you our stories or to share our experiences. There's a whole lot of listening that still needs to be happening. That I feel like the listening is happening in the community spaces, but it's not necessarily like going up and up and up the ladder where it needs to
Right.
go for structural change to happen. So the extent to which you can, I see a lot of sort of more grassroots organizations or more community-based organizations kind of getting into a little bit of like lobbying and trying to understand like, okay, there are real policies that could be shifted here, and the extent to which you can support organizations that are kind of both doing some of that work, like doing the actual supportive work at the community level, but also then trying to move that up. Or if you've got like skills to be able to think about how to move that up, partner with those organizations, because sort of both things need to be happening. Like there needs to be things that are happening from the ground up, but then there are things that need to start happening from the top down. I don't know if
Awesome.
that was answering the question. I hope it was.
I mean, I thought so. Well, thank you. We seriously can't thank you enough. Chat, please give a big, warm thanks to Dr. Lozada. Thank you so much. That was amazing. That was a breath of not like I will be rewatching this VOD because there's a lot that I need to take in that you said that we'll need a few more times to get in the right way. So thank you so much. Please, everybody, check out these links. Dr. Lozada, how can people find out more and like just promote all the things you want to promote and talk about all the things that are relevant to you and important?
Oh my goodness, there are so many things. But you could certainly follow me on Twitter at Dr. Fantasy Losada. And that I try to tweet out a lot of things like highlighting different organizations or highlighting different movements or events or people who are doing really great work around mental health, or just promoting sort of positive development of Black and Brown youth. So I try to get a lot of information out there. I Yeah, I guess I would say that's probably where I'm most active at, and you could probably see the most at. You could also check out my website, the shieldlabresearch.org, where we try to shout out our community partners and kind of talk a little bit about we're I'm excited about it, but it's going like kind of slow. We're trying to put out these comics strips that are boiling down some of these like really important topics that we're talking about
Oh,
in
that's
ways
awesome.
that are accessible to people. So we call them Shield comics. We've got one up there. Some more are some more will follow at some point, but we're working on it. We're trying to find ways to just engage people in this conversation. But I'm happy to engage with people there on Twitter, and yeah, to continue this conversation. I've really enjoyed it a lot. Thank you so much,
Oh,
everyone in the chat, for your questions. I enjoyed them.
thank you so much. We're going to be right back, everybody. Thank you again, Dr. Lozada. I'll see you all soon.
Thanks, Marie.